What interests you about working in dialysis nursing specifically?
I have always been drawn to areas of nursing that allow me to build long-term relationships with patients while making a significant impact on their quality of life, and dialysis nursing perfectly aligns with these values. What interests me most about this specialty is the opportunity to work closely with patients who require ongoing care and support. Managing chronic conditions like kidney disease requires not only technical expertise but also a deep sense of empathy and dedication to patient education. In dialysis nursing, I find a balance between the technical aspects of operating and managing dialysis equipment and the human-centered care that focuses on understanding the emotional and physical challenges patients face. I enjoy the complexity of monitoring patients' conditions, managing treatment plans, and collaborating with multidisciplinary teams to ensure the best outcomes. Moreover, dialysis nursing is a field where education and advocacy play a crucial role. I take pride in helping patients understand their condition and empowering them to make informed decisions about their health. This holistic approach to patient care, where I can combine my clinical skills with compassionate interaction, is what truly excites me about this specialty. Lastly, I see dialysis nursing as an area that offers continuous learning opportunities, especially with advancements in technology and treatment modalities. The dynamic nature of this field keeps me motivated to enhance my knowledge and skills, ensuring that I can provide the highest standard of care to my patients.
Describe your experience with vascular access care.
In my nursing practice, I have gained extensive experience in vascular access care, particularly in the context of dialysis treatment. I understand that maintaining and monitoring vascular access is critical for ensuring effective dialysis and preventing complications, which requires both technical proficiency and meticulous attention to detail. My experience includes caring for various types of vascular access, such as arteriovenous, AV, fistulas, AV grafts, and central venous catheters, CVCs. For AV fistulas and grafts, I am proficient in assessing the access site for patency, checking for proper thrill and bruit, and identifying any signs of infection, stenosis, or thrombosis. I also educate patients on the importance of maintaining good hygiene and avoiding activities that could compromise the access site. In cases involving CVCs, I have managed catheter care by following strict aseptic protocols, including regular dressing changes, flushing the catheter to maintain patency, and monitoring for potential complications such as infection or dislodgement. I am also experienced in troubleshooting issues such as occlusions and collaborating with the healthcare team to resolve them promptly. Throughout my career, I have emphasized patient education, ensuring they understand how to care for their vascular access and recognize early warning signs of complications. My goal has always been to empower patients while maintaining the highest standard of care, which helps optimize their dialysis experience and overall health outcomes.
How do you handle a patient who is experiencing hypotension during dialysis?
When a patient experiences hypotension during dialysis, my primary focus is on ensuring their safety and stabilizing their condition promptly. This involves a combination of immediate interventions, continuous monitoring, and clear communication with both the patient and the healthcare team. The first step is to recognize the signs of hypotension, such as dizziness, nausea, sweating, or a significant drop in blood pressure. I immediately reduce the ultrafiltration rate to minimize fluid removal, as excessive fluid removal is often a primary cause of hypotension during dialysis. I also lower the head of the patient's chair or bed and elevate their legs to improve venous return and stabilize blood pressure. If the patient's condition does not improve, I assess their intravascular volume and may administer a bolus of saline, as per protocol, to restore circulating volume. I continue to closely monitor the patient's vital signs and response to interventions, ensuring that they are stable before resuming dialysis at a slower and more cautious rate. Throughout the episode, I communicate with the patient to reassure them and keep them informed about what is happening. This helps reduce their anxiety, which can further affect blood pressure. Additionally, I document the incident thoroughly and report it to the nephrologist or supervising healthcare provider to adjust the treatment plan if necessary. Finally, I work with the patient to identify potential contributing factors, such as recent dietary changes, fluid intake, or medication adjustments, and provide education on how to prevent future episodes. By combining prompt action, vigilant monitoring, and patient-centered care, I ensure that the patient's immediate needs are met while addressing the underlying causes of hypotension.
How do you educate patients about their dialysis treatment and self-care?
Educating patients about their dialysis treatment and self-care is a vital aspect of my role as a dialysis nurse. I approach this responsibility with a focus on clear communication, empathy, and tailoring information to each patient's unique needs and level of understanding. My goal is to empower patients with the knowledge and confidence they need to take an active role in their care and improve their quality of life. I begin by explaining the dialysis process in simple terms, emphasizing its purpose in removing waste products and excess fluids when the kidneys are unable to do so. I use visual aids, such as diagrams or videos, to help illustrate how the dialysis machine works and the role of vascular access in the treatment. This ensures patients understand what to expect during their sessions. Next, I address the importance of self-care, starting with vascular access maintenance. I educate patients on how to check their access daily for signs of patency, such as the presence of a thrill or bruit, and how to recognize warning signs of complications like infection or clotting. I also discuss the need for proper hygiene and avoiding activities that could damage their access. Dietary and fluid restrictions are another critical area of education. I collaborate with dietitians to help patients understand how managing their fluid intake, potassium, sodium, and phosphorus levels can significantly impact their overall health and dialysis outcomes. I provide practical tips for adhering to their diet and encourage them to ask questions about foods they enjoy. Additionally, I ensure patients are aware of the potential symptoms to watch for, such as signs of fluid overload or low blood pressure during dialysis, and I teach them when and how to seek medical attention. For patients who may feel overwhelmed, I break the information into manageable parts and provide written materials or follow-up discussions to reinforce their understanding. Throughout the education process, I maintain a patient-centered approach, listening to their concerns and adapting my teaching methods to their preferred learning style, cultural background, and personal circumstances. This collaborative and supportive strategy fosters trust, encourages compliance, and ultimately helps patients feel more in control of their treatment journey.
How do you prioritize patient care in a busy dialysis unit?
Prioritizing patient care in a busy dialysis unit requires effective time management, clinical judgment, and the ability to adapt to dynamic situations. I approach this by focusing on patient safety, clinical urgency, and efficient communication with the healthcare team. My first priority is always to address any immediate or life-threatening conditions. For example, if a patient shows signs of complications such as hypotension, chest pain, or access-related issues, I intervene promptly to stabilize them and escalate care as necessary. These situations take precedence over routine tasks to ensure patient safety. Once urgent needs are managed, I organize my workload based on the acuity of patients' conditions and treatment schedules. I assess each patient at the start of their session, monitoring their vital signs and pre-dialysis assessments to identify any early signs of complications. I ensure that patients with more complex needs, such as those with new vascular access or comorbidities, receive the appropriate attention and care throughout their treatment. Simultaneously, I strive to maintain the unit's efficiency by adhering to treatment schedules and managing transitions smoothly between shifts or patient rotations. I stay mindful of the need to prepare machines, verify prescriptions, and complete documentation in a timely manner without compromising the quality of patient care. Teamwork is also essential in a busy dialysis unit. I communicate regularly with colleagues, delegate tasks when appropriate, and offer support to ensure that all patients receive consistent and high-quality care. For example, if another nurse is managing a critical situation, I step in to assist with their patients to prevent delays in care. Lastly, I prioritize building rapport with patients, even in a fast-paced environment. Taking a moment to reassure them, address their concerns, or provide brief education contributes to a positive care experience and helps maintain trust, which is crucial in long-term dialysis care. Balancing these aspects effectively allows me to provide patient-centered care while ensuring the overall efficiency of the unit.
What are some common complications associated with dialysis?
Dialysis, while life-saving, can be associated with several common complications, many of which require prompt recognition and management to ensure patient safety and comfort. These complications can vary depending on the type of dialysis, hemodialysis or peritoneal dialysis, but some issues are more universally observed. One frequent complication of hemodialysis is hypotension, caused by excessive fluid removal during treatment. This can lead to symptoms such as dizziness, nausea, or fainting, and requires immediate intervention, such as reducing the ultrafiltration rate or administering a saline bolus. Infection is another significant risk, particularly related to vascular access sites like arteriovenous, AV, fistulas, grafts, or central venous catheters, CVCs. Patients with peritoneal dialysis are at risk of peritonitis if the catheter or abdominal cavity becomes contaminated. Infection prevention, through aseptic techniques and patient education, is crucial to minimizing this risk. Thrombosis or clotting in vascular access sites can impede dialysis efficacy and requires interventions such as declotting procedures or revisions to the access site. Regular monitoring of vascular access is essential to detect these issues early. Electrolyte imbalances, such as hyperkalemia or hypokalemia, can occur due to inadequate dialysis or changes in diet and medication. Similarly, rapid shifts in electrolytes during dialysis may lead to muscle cramps or arrhythmias, which require careful management of treatment parameters. Dialysis disequilibrium syndrome is a rare but serious complication that can arise when fluid and urea are removed too quickly, causing neurological symptoms such as headaches, nausea, seizures, or, in severe cases, coma. This typically occurs in new dialysis patients and is prevented by starting treatment at a slower rate. Anemia and bone disease are chronic complications of dialysis due to reduced erythropoietin production by the kidneys and imbalances in calcium and phosphate metabolism. These are managed through medications, dietary modifications, and supplements. Lastly, patients may experience fatigue or a reduced quality of life due to the physical demands of regular dialysis sessions and their underlying health conditions. Addressing this requires a holistic approach that includes patient education, lifestyle counseling, and psychological support. By staying vigilant, maintaining clear communication with patients, and adhering to evidence-based protocols, these complications can often be effectively managed or prevented.
How do you handle a patient who is noncompliant with their fluid restrictions?
Handling a patient who is noncompliant with their fluid restrictions requires a combination of empathy, education, and collaborative problem-solving. My approach focuses on understanding the root causes of their noncompliance, addressing barriers, and fostering a partnership that encourages adherence to their care plan. First, I start by having a non-judgmental conversation with the patient to understand their perspective. I ask open-ended questions to explore why they are struggling with fluid restrictions. This might reveal underlying challenges, such as a lack of understanding about the restrictions, emotional stress, or habits that are hard to change. By listening attentively, I can tailor my response to their specific situation. Next, I provide education on the importance of fluid restrictions, explaining how excess fluid intake can lead to complications like shortness of breath, swelling, high blood pressure, or even life-threatening conditions such as pulmonary edema. I use visual aids and simple analogies to make the information more relatable, emphasizing the direct impact on their well-being in the dialysis process. To support adherence, I collaborate with the patient to find practical solutions. This might involve helping them identify ways to track their fluid intake, suggesting alternatives like sucking on ice chips or chewing gum to alleviate thirst, and addressing dietary habits that might contribute to fluid retention, such as high sodium intake. If necessary, I involve dietitians or other team members to create a comprehensive plan that aligns with the patient's preferences and lifestyle. I also address the emotional aspects of noncompliance. Many patients feel overwhelmed by the demands of dialysis and restrictions, which can lead to frustration or denial. By providing encouragement, validating their feelings, and reinforcing their progress, I aim to build trust and motivation. Finally, I consistently monitor and discuss their progress during dialysis sessions. Celebrating small successes and providing ongoing feedback can strengthen their commitment to following fluid restrictions. If challenges persist, I involve the broader healthcare team to reassess their care plan and ensure a multidisciplinary approach to improving adherence. Through empathy, education, and collaboration, I strive to help patients feel empowered and supported in managing their fluid restrictions, leading to better outcomes and a higher quality of life.
What is your understanding of infection control practices in a dialysis setting?
Infection control practices are critical in a dialysis setting to protect both patients and healthcare staff from potentially life-threatening infections. My understanding of these practices is rooted in adherence to strict protocols, maintaining aseptic techniques, and fostering a culture of safety and vigilance. A key aspect of infection control in dialysis is preventing infections associated with vascular access. For patients with arteriovenous, AV, fistulas or grafts, I ensure regular monitoring for signs of infection, such as redness, swelling, warmth, or discharge, while maintaining strict hand hygiene and glove use when assessing or touching the site. For patients with central venous catheters, CVCs, I follow meticulous aseptic techniques during dressing changes, catheter handling, and flushing procedures to minimize the risk of bloodstream infections. Environmental cleanliness is also paramount. I ensure that all equipment, including dialysis machines, is disinfected thoroughly between patients according to facility protocols. This involves using appropriate cleaning agents and following manufacturer guidelines to prevent cross-contamination. Hand hygiene is a cornerstone of infection control. I strictly adhere to the 5 moments for hand hygiene framework, which includes washing or sanitizing hands before and after patient contact, before aseptic procedures, and after exposure to bodily fluids or contaminated surfaces. Proper use of personal protective equipment, PPE, such as gloves, masks, and gowns, further reduces the risk of transmitting pathogens. Education plays an important role in infection prevention. I educate patients on how to care for their vascular access at home, maintain hygiene, and recognize early signs of infection. This empowers them to be active participants in their care and helps prevent avoidable complications. Lastly, I stay updated on infection control guidelines from organizations like the Centers for Disease Control and Prevention, CDC, and implement them in daily practice. Regular participation in training sessions and audits ensures that my knowledge and skills remain current and aligned with the highest standards. By combining vigilant monitoring, evidence-based practices, and patient education, I strive to create a safe dialysis environment that minimizes the risk of infection and promotes overall patient well-being.
How would you handle a situation where a patient is refusing dialysis treatment?
Handling a situation where a patient refuses dialysis treatment requires a compassionate, patient-centered approach that respects the individual's autonomy while emphasizing the importance of their health and well-being. My goal in such situations is to understand the patient's concerns, provide comprehensive education, and collaboratively explore solutions to address their needs. The first step is to engage the patient in an open and non-judgmental conversation to understand the reasons behind their refusal. Patients may refuse dialysis due to fear, frustration, fatigue, misunderstandings about the treatment, cultural or religious beliefs, or feelings of hopelessness. By actively listening and validating their emotions, I create a space where they feel heard and respected. Once I understand their perspective, I provide education tailored to their specific concerns. For example, if a patient is worried about pain or discomfort, I explain how we manage symptoms to make the process as comfortable as possible. If their refusal stems from a lack of understanding, I use simple language and visual aids to explain the role of dialysis in maintaining their health and preventing life-threatening complications. Empathy is critical in these conversations. I emphasize that my primary concern is their well-being and work to build trust by addressing their fears and providing reassurance. In some cases, involving family members or loved ones can help reinforce the importance of treatment and provide additional emotional support. If the patient continues to refuse, I respect their autonomy while ensuring they fully understand the potential consequences of their decision. I document the discussion thoroughly, including their stated reasons for refusal and the information provided. I also inform the attending nephrologist and the healthcare team to ensure a multidisciplinary approach. Social workers, counselors, or chaplains may be involved to provide additional support. Ultimately, I strive to balance the patient's right to make their own choices with my duty to advocate for their health. Even if a patient ultimately refuses treatment, I remain supportive and continue to provide care in other areas, ensuring they feel respected and valued throughout their healthcare journey.
What are your thoughts on the importance of interdisciplinary collaboration in dialysis care?
Interdisciplinary collaboration is essential in dialysis care because it ensures a holistic and comprehensive approach to managing patients with chronic kidney disease. Dialysis involves more than just the technical process of removing waste and excess fluid from the body, it impacts every aspect of a patient's physical, emotional, and social well-being. Effective collaboration among healthcare professionals is critical for addressing these multifaceted needs and delivering the highest standard of care. In a dialysis setting, each team member brings unique expertise that contributes to the patient's overall care. Nephrologists provide medical oversight, prescribing dialysis treatments and managing underlying conditions. Nurses play a central role in administering dialysis, monitoring patient responses, and educating them about self-care. Dietitians ensure that patients follow appropriate dietary guidelines to maintain their health, while social workers address emotional and psychosocial challenges, such as adjusting to the demands of dialysis or navigating financial and logistical barriers. When these professionals work together seamlessly, patients receive well-rounded care that addresses their medical, psychological, and lifestyle needs. For example, a nurse who notices a patient struggling with fluid restrictions might collaborate with the dietitian to develop practical strategies or involve the social worker to explore underlying stressors. Similarly, open communication with the nephrologist ensures that any changes in a patient's condition are promptly addressed, leading to timely adjustments in treatment plans. Interdisciplinary collaboration also improves patient outcomes by fostering consistent and coordinated care. Regular team meetings, shared documentation, and open communication channels ensure that everyone is aligned in their goals and aware of the patient's progress. This reduces the risk of errors, minimizes gaps in care, and helps build trust with the patient, who feels supported by a cohesive team. Furthermore, collaboration strengthens the overall healthcare environment by promoting mutual respect and professional growth. Sharing insights and learning from one another's perspectives enhances the team's ability to solve complex challenges and adapt to new developments in dialysis care. In my practice, I actively contribute to and value interdisciplinary collaboration. I believe that by working together, we not only improve individual patient outcomes but also create a supportive and innovative environment that benefits both patients and the healthcare team.